The Medical Minute, brought to you by Health City Cayman Islands.
Diabetes is a controllable disease. If you follow a healthy diet, get regular exercise, and follow your doctor's directions for taking medication, then you can control your diabetes. Diabetes is not a curable disease, it's what we call a controllable disease. People with diabetes need to watch the total amount of carbohydrate that they consume. This means not only watching the amount of carbohydrate they get from sweets, such as desserts, but also cutting back on carbohydrates that they get from their starchy foods. Starchy foods includes rice, potato, bread, and pasta. What one wants to do is not only watch the portion sizes they have of these foods, but also switch out the refined carbohydrates for the more complex, higher fiber ones. Not all carbohydrates are created equal. We want to watch the amount of carbohydrates we have, but it also is important which type of carbohydrate we get. We want to get a high fiber carbohydrate. What this means is choosing a whole grain carbohydrate. For example, 100% whole grain bread instead of white bread. The portion sizes of our food is very important. A nice meal planning tip that I like to give people is to think of their plate as having 3 sections to it. The first section is going to be vegetables, and that needs to take up half the plate. By doing this makes sure you get enough fiber and you get your vitamins and your antioxidants as well. A quarter of the plate is then going to be carbohydrates, and then another quarter is going to be your protein food. It is best to choose lean protein foods such as chicken and fish that are not made with a lot of oil. This means grilling, baking, or roasting your protein foods and not having them fried. It's important for people with diabetes to not only pay attention to what they're eating, but also the timing of the meals as well. For most people, this means eating every 4 to 6 hours, so 3 meals a day with 1 or 2 snacks in between, and obviously starting off the day with breakfast. For most people with diabetes, weight loss is a good management tool to help control your diabetes as well. So most people will need to follow a bit of a more calorie-restricted diet. It's good to meet with a registered dietitian to help go over a specific meal plan tailored to your specific needs.
The Medical Minute, brought to you by Health City Cayman Islands.